Hey everybody, it's Matt Hsu from Upright Health, and today we're looking at another research review on FAI from the journal Osteoarthritis and Cartilage from 2013. We have an article called Fulfillment of Patient-Rated Expectations Predicts the Outcome of Surgery for Femoroacetabular Impingement. This is based on research done at the Department of Research and Development and the Department of Orthopedic Surgery at the Schulthess Clinic in Zurich, Switzerland. And in this study, they basically looked at the satisfaction ratings for patients before they had surgery for FAI and after. So they had a 1-year follow-up period, and they basically started the study by getting a baseline reading, finding out what people's expectations were for the surgery, what they were hoping to improve, and then following them for the next year and finding out what their general satisfaction level was, whether their expectations were met or not. One of the reasons they wanted to study the kind of expectations and whether or not the expectations were met is because you have this idea sometimes that if you can set high expectations, if you tell patients, oh, you're going to get really healthy and everything's going to be great, you may have something of a placebo effect in which you're performing the surgery, you set these high expectations, and so because of this mental high expectation, they end up with a good result. So maybe you could get away without doing the surgery. So it's just something to look at, and that's what they looked at. And what they found was that the high expectations actually did not result in better results. So what you're going to find here is that the results are actually a little bit sobering. So it's very good information to consider if you're thinking about whether or not the surgery is a good idea. Number one, based on all the other evidence that we've presented about arthritis, about the cause of pain. But now you can even see the actual satisfaction rates with surgery. So, so in this study, I'm just going to give you the highlights. They asked people what their top reasons for surgery were, and the number one reason, the most common reason was 33% of the patients ranked alleviation of pain as the very most important reason for them to get hip surgery. Another 28% of people ranked it as the second most important reason. So you have 50% of these patients ranking this very highly, and that makes sense. You want to get out of pain. Then they had another 20% who chose fear of worsening the situation as their top reason, and 16% chose their major reason as anticipated improvement in the ability to perform everyday activities, and 11% were doing surgery because other therapies hadn't helped, and then 10% had an anticipated improvement in the ability to play sports. So you have your number one biggest reason is getting rid of the pain, and then you have people who are afraid that things are going to get worse, and then you have people who want to improve their ability to do things, so sports, everyday activities. Those are very reasonable things that they want to improve, right? So basically we've got these expectations set, right? And what they found was that more than half the group expected that their hip pain would be much better, so much better, and a further 40% expected it would be better. A high proportion also expected their ability to do sport to be much better, and that's at 46% of these respondents expected their ability to do sport to be much better, and 37% expected their ability to do sports to be better, at least something better, right? So people are going in with expectations of relief of pain and the ability to perform better in sports, and what happened was that the 1-year follow-up, let me quote from the study, in comparison with the actual perceived improvement registered at 12 months, the expectations declared before surgery had been overly optimistic in more than 50% of patients for hip pain, sport, and general physical capacity, and in 34 to 46% of patients for independence, mental well-being, and walking capacity. So I'm going to say that again. The patients were over-optimistic. 50% of them were over-optimistic in terms of hip pain, improvement in hip pain, sport, and general physical capacity. And 34 to 46% of them were overly optimistic for independence, mental well-being, and walking capacity. So what does that mean? Well, the way they phrased it makes it sound like the patients made a mistake mentally. What's happening here is the expectations of improvement are simply not being met by the surgery. So actual ratings after 12 months, the general ratings from the patients about whether or not the operation helped. 29% of the patients said the operation helped a lot. 39% said it helped. 21% said it helped only a little. 9% said it didn't help, and then 2% said it made things worse. So you actually have, I would say, about 32% who basically underwent a really drastic surgical procedure to get only a little help, no help, or end up worse. 39% said it helped, and then only 29% said it helped a lot. So those are kind of interesting odds because it's about a third, right? You got a third of helped a lot, third of helped, and then a third of iffy or maybe made things worse. At least the made things worse is a very small percentage, so that's good. But you have a pretty hefty percentage where it's a 30%. It didn't help or only helped very little. So one of the conclusions of this study is that expecting a really great result is not, well, I'll quote here, it's not in itself sufficient to guarantee that such improvement will be achieved. Instead, the fulfillment of realistic expectations appears to be the critical determinant. So that means that the patient expectations need to be set appropriately. Right now, at the time of this publication, what they are basically showing is that patients are going in with expectations that have been set too high, which means the conversations that they're having with the physicians are not very clearly laying out realistic expectations. So people are expecting all their pain to go away, they're expecting their ability to perform in sports to be much, much better, and as this study noted, it's simply not happening. The numbers are just not great. So again, to summarize, after 12 months, expectations declared before surgery, 50% of patients were disappointed in regards to hip pain, sport, and general physical capacity, and 34 to 46% of the patients did not have their expectations met for independence, mental well-being, and walking capacity. So I will provide the link for this. It's again in the Journal of Osteoarthritis and Cartilage. Definitely worth a read, especially if you're considering going into surgery and are expecting it to make everything perfect and better for you. So I hope that gives you some food for thought. Please remember that pain sucks. Life shouldn't.